The placebo effect is a phenomenon in which a patient experiences a perceived improvement in symptoms or overall well-being after receiving a treatment that has no therapeutic effect. This improvement is not a result of the treatment itself but is rather attributed to the patient's belief in the efficacy of the treatment. The placebo effect is a complex interplay of psychological, neurological, and physiological factors. Key points about the placebo effect include: psychological factors. Belief and expectation play a significant role in the placebo effect. When a person believes that a treatment will be effective, the brain can trigger the release of neurotransmitters and other chemicals that contribute to a sense of well-being or relief from symptoms. Neurological mechanisms. Neurotransmitters such as endorphins, dopamine, and serotonin can be released in response to positive expectations. These neurochemicals can have analgesic, pain-relieving, and mood-enhancing effects, contributing to the perceived improvement in symptoms. Physiological responses. The placebo effect is not merely psychological. It can also lead to measurable physiological changes. For example, improvements in pain perception, immune system function, and even objective physiological measures like blood pressure may be observed. Conditions affected by placebo responses. The placebo effect is often studied in the context of pain management, depression, anxiety, and other subjective conditions. However, it can also influence objective measures, such as the effectiveness of certain medications or medical procedures. Placebo control in clinical trials. In clinical trials, researchers use a placebo group to control for the placebo effect. This helps distinguish between the actual effects of a treatment and those resulting from the patient's expectations or beliefs. Belief and the patient's mindset can influence health outcomes in various ways. Some key factors include: mind-body connection. The mind and body are interconnected, and psychological factors can impact physical health. Positive beliefs and attitudes may contribute to a more robust immune system, better stress management, and overall well-being. Stress response. Believing in the effectiveness of a treatment can reduce stress and anxiety, which, in turn, can positively affect health outcomes. Chronic stress is associated with a range of health problems, and mitigating stress can have beneficial effects. Adherence to treatment. Patients who believe in the efficacy of their treatment are more likely to adhere to prescribed medications or follow recommended lifestyle changes. Improved adherence can lead to better health outcomes. It's important to note that while the placebo effect can result in subjective improvements, it does not address the underlying cause of a medical condition. Scientifically validated treatments based on evidence remain crucial for managing and treating various health issues. The placebo effect is primarily a fascinating aspect of how the mind and body interact, and its exploration contributes to a better understanding of the complex nature of health and healing.